right, so welcome to the Hume Region webinar on dignified and respectful decisions with the wonderful Tiffany Batten. I'll just give you a bit of an introduction to Tiffany. So she's been a critical care nurse with over 10 years experience working in intensive care units across Australia and in the UK. And over the course of her clinical career, she's pursued roles in clinical education, management and coordination before moving into the field of public health. She's currently working for Palliative Care Victoria as a project officer for aged care. And this is the big project that she's been working on. And she's here to tell us all about it today. So Tiffany, welcome.
Thank you. No, I appreciate you all having me. I know most of you are working within residential care services within the Hume region. So I would like to acknowledge, before we begin, the traditional owners of the lands and custodians on which we're working, and knowing that they're obviously very different across Victoria. The Palliative Care Victoria would like to acknowledge that this land is not being ceded and that we do pay our respects to our elders past, present and emerging. So thank you for having me today. Before I really get into the nitty-gritty of what this project was about, I wanted to introduce you to Nola, who I think is a great example of why we started this project in the first place.
My husband had been unwell for a number of years and I cared for him at home, and so we just led a very quiet life because socially it was difficult. I had to carry the load of the social interactions. Finally, after a number of years, it just became overwhelming. My husband was a GP and he looked after people in aged care, and he would come home regularly and say, "That is not the way I'm going to finish. There is no way that I'm going into care." So that made the load for me even harder because we talked about it, and yet I had to make that big step to put him into aged care. When he went into the nursing home, it was absolutely dreadful. I came home every day because the nursing home's just down the road. I went there every day and I'd come home and I would cry. It was really, really hard. So I had grief counselling, which was absolutely amazing for me. One of the things that was interesting about that was that all my life I'd been a wife and a mother and a caregiver, and the psychologist actually wanted to know about me so she could help me with my grief. And I found it really difficult to talk about me, and it took about 3 visits before I actually knew what to say about me, because I kept talking about us and the family. So that was a wonderful thing to happen, and I would recommend that people in a similar circumstance might consider that. So if I was to say that I felt really supported by palliative care, it's important to know that palliative care spreads over quite a long time and you don't have to wait until the end. And that palliative care is to make your life better, not only to make your death better.
Nola was one of multiple people in the community who had a lived experience of caring for someone who ended up living in residential aged care with a life-limiting condition, and her husband Henry passed away while living in care. The resource that I'm talking to you today has been developed following the outcomes from the Royal Commission, which wanted to improve the standard of palliative care in residential aged care. But more specifically, this resource we've developed is designed to talk to families. We appreciate there is a lot of fantastic work already being done in the palliative care space within our services, and we have not come to reinvent the wheel and teach services how to deliver palliative care. Instead, we've taken another angle where we are talking to families and hoping to empower them and improve their understanding of palliative care and those steps before palliative care leading up in getting prepared for those conversations, in hope that it will have better outcomes for older residents living in residential aged care. Although the information is designed for people living in residential aged care specifically, Much of the information is transferable, and we've actually been giving information sessions for home care services and allied health aged care providers, because we have found through a lot of these conversations that these discussions start much earlier than when the person hits the doorstep of a residential aged care home. Many of them start when a person is diagnosed with chronic illness or a life-limiting condition, and when they start to have health changes associated with those conditions. And what I'm going to talk to you today about this resource will cover how these how this information can be used at different time points in an older person's life with their family in these conversations. So back to where it all started. When we put this project together, we basically did a large literature search of what the challenges were for substitute decision makers already. We then spoke to a number of people in the community who were living through the experience, as well as people from the industry itself, including residential aged care staff, palliative care specialists, the in-reach departments and link nurses through acute hospitals supporting residential aged care. And then all of them told us very similar things of palliative care is well and truly done in residential aged care. There are many resources, they're all available. You don't need to do this project. You're going to reinvent the wheel. So then our next step was to catalogue every resource we could find about this space. And through this, we came away with a few key learnings. One, there is some fantastic work available and some incredible resources, and I encourage everyone to jump on Palliative and Care Search and go find them. I think that there is incredible care models. There are tools that have been done to assess deterioration in palliative care, and they're all very supportive of the work that is already going on. One thing we did notice, though, is there are very few resources that talk to carers who have someone in formal care. This tends to be a cohort of people who aren't well recognised, and there is this sense that once a person moves into residential aged care, their responsibilities as a carer stops. However, we know that they are still asked to develop advanced care plans for their loved ones. They're still asked about care decisions quite ongoingly, and often they're quite complex decisions to be made in a time where they're already going through a bit of grief and distress themselves. When we decided to put resources together, we developed these through an iterative process, meaning we assembled two groups, one from industry and one from people with lived experience, who would review the material we were preparing and give us guidance on whether it was accurate and whether it was relevant and helpful for their needs. We used this co-design process to also identify how this information would be used by services and ensure that it really reflected the full picture and not just what one side of the coin would actually see is going on for carers. We also wanted to acknowledge that Victoria has a very diverse community, and we have established these resources in up to 10 languages, which are currently in development as well. We are very open to feedback and very open to continuing this iterative process. So for anyone listening, as you experience this resource and start using it with your services, please let us know if there are changes to be made or there are elements that you think could be improved. What is this resource itself? Well, at the very base, it's a website. The website itself follows 4 sections, and these 4 sections essentially follow the linear journey of someone living in residential aged care. However, this journey can be mimicked for anyone living in home caring services or at the beginning of their chronic illness and end-of-life pathway in general. So being prepared is when you start looking at what is a person's advanced care plan wishes. If they haven't formally documented them, how would you identify those wishes? And we give practical guidance on where you can turn in the community to help get that information to build a more comprehensive picture of what your loved one would want should they come to the point of needing increased care needs. We also discuss the emotional preparation required, and this is where we acknowledge that it is quite an overwhelming and emotionally charged journey to be a substitute decision maker, and strategies that you can put in place to help relieve some of the burden of that role. When we talk about working together, this is the nuts and bolts of how a residential aged care home works. So this is looking at who key staff in the facility are, understanding some of those technical processes like care plans or family meetings, but more importantly, talking to the value of a collaborative relationship. So establishing trust with the staff who are caring for your loved one and building that conversation over time so that when you start getting to the pointy end of things, you feel like you have transparency and you can actually make constructive decisions together through that relationship. Making decisions is where we start looking at the different types of decisions you may need to make for your loved one as their health changes. So particularly for people living in residential aged care with complex conditions, chronic diseases, such as dementia or heart failure, this would be looking at what is their condition now, how is that likely to change over time, and what can you put in place to prepare for those changes that will occur. We don't at any point tell people the right or wrong, the do's and don'ts, or what they should decide. The structure of these materials is to help guide their thinking in how to answer those questions themselves. And the crux of it is really, as a substitute decision maker, how do you make a decision that would align with what they would choose for themselves if they could talk to them themselves? We don't talk about whether you should or shouldn't go to hospital, but we do raise the elements you should consider when a person has to go to may require going to hospital, and how you can make that judgment call based on the circumstances unique to a specific family member. The end of life care section is where we start looking at the bread and butter of palliative care, and this is one, what palliative care looks like for the older person living in residential aged care, when it can be introduced and how that can escalate over time in terms of the amount of support required. We also look at the role of the substitute decision maker during this time. So how can family members be present for their loved one while they're receiving palliative care in the aged care home? We go through the important elements in terms of wellbeing for carers, including grief support and looking after yourself in what is, again, a very emotionally charged and distressing time for many family members. Alongside this website, we have additional resources, and these are scattered through the various sections of the site, and I really encourage you to kind of have a click and play. They're designed to complement the material that's been shared. Things like a glossary of terms, where we start talking about the terminology of advanced care plans or dementia or life-limiting illness. You can then turn back to this glossary as a family member and reinforce what it is a nurse or a doctor has been talking to you about. There are a number of videos and animations through the site, which you've seen little cutouts thereof, and these are designed off real scenarios from real people to give people something to relate to. These can range from understanding goals of care and treatment limitation to talking about how your identity can change when your loved one moves into care and how that can actually take a period of adjustment in itself. Nola is but one video we feature within the site where she shares her story and some of the challenges that she navigated in her role. Alongside these digital images and resources, we have some downloadable resources. So there is a wellbeing support A4 sheet for families, and this is very much tips and tricks on how to navigate some of those wellbeing aspects of being a carer, whether it's managing grief, staying healthy and up to date with things going on in the community outside of your residential care home, coping with that change of role, or just reaching out for support, whether it's through local friendship circles or family, or more structured support through support groups or going through professional help via your GP. There is also a guiding checklist, and this is designed as like a checkbox tip-by-tip list, structured within each of the sections of the site, that family members can download as an A4 sheet and gives practical tips on what to consider next when your family member is in that stage of their admission. There are a number of multilingual resources I mentioned being developed, and watch this space because we're hoping to have them available in the coming months. Alongside these resources, there's some practical information for healthcare workers to share with families. So there is a common medical treatment section in which families who have been asked to make decisions about technical terms such as CPR, interventions for eating and drinking when they're starting to reduce, whether a person continues antibiotics, or whether a person just has simple ongoing interventions such as screening, scans, tests, procedures. How does someone navigate those decisions, and what would that mean for the older person living in care? Additional resources throughout the site point people in the direction of more structured support and information. So we have a guide on dementia, which helps families understand different types of dementia, the progression and how it will change over time. There are resources about grief and how you can reach out for support through Bereavement Australia. There's information about if you have difficulty with conflict in the family, about who is the decision maker and where you would reach out to the Office of the Public Advocate or the Advanced Care Planning Australia team. One piece of feedback we got by talking to people living the experience is sometimes a website doesn't cut it. And particularly when we're talking to our spouses who are themselves in their 80s, they may not be as comfortable logging on to the internet and reading some of these pieces of material. So to coincide with this website, we've actually developed a hard copy booklet, which you'll see in the centre of your screen. These are available free of service from our organisation, and many of you have probably seen them arrive on your doorstep in the last week or so if you're working in a residential care home. The idea behind these booklets is not to replace the site, but to give a condensed summary of each of the 4 sections to give an introduction to the terms. They're not designed to replace well-trained staff and good conversations. They're purely there to complement it. The idea is that as a health professional, we have these conversations with families when they're at their most emotionally charged and distressed points. And this enables them to take something away, reflect on it and read it in their own time and reinforce some of those messages we would have shared. For some services, there is an A3 poster available on the left-hand side with a QR code. Some homes are displaying these in their central areas where the QR code is then accessible to the site. So their family members, as they're coming to visit their loved ones, can then access. Oh, sorry. The sheets on the right-hand side, you'll notice, are just the A4 downloads that are available. We actually have them printed ourselves, and we're happy to distribute copies as requested. How are teams using this material? Well, as we said, they're used at multiple time points, and we know from our academic literature search, the best end-of-life conversations and decisions are made when there's early and often conversations preceding it. So if we start having conversations about someone's preferences for end-of-life care or preferences for care as their health changes and deteriorates on admission, it'll make it easier when we get to their resident of the day review or their advanced care plan review. It can actually come up during their critical events, or if there's a fall or an incident, when we want to talk to a family member about what would we do if, particularly if someone has deteriorated and we've been able to assess it and we know that we've got to call the family in to start discussing it. They can also be used very helpfully when someone wants to start a palliative care pathway in helping families to understand that slow movement and disease trajectory of someone of older age living with chronic illness versus what people traditionally think of with palliative care in the younger population with more acute fluctuations and highs and lows. As we know from our experience, the older patient and resident typically has a very slow decline, and it's those small events that stockpile to then become a terminal event typically. From here, what are we asking? Well, as Palliative Care Victoria, we are trying to spread the message and get these resources into the hands of as many healthcare workers as we can. We are happy to provide printed copies of these booklets, as well as the translated materials once they're available to your services free of charge. We are happy to give individual information sessions, much like this one, and we can tailor it to the needs of your services as well. And for some organisations interested, we also have some partnership opportunities available. And that's pretty much the structured part of this exercise. So I might open the floor to conversation and questions if there are any.
Thank you so much, Tiffany. Yeah, if anybody has any questions for Tiffany, please do take the opportunity to ask away.
And perhaps if you yes, put yourself on video so we can see you as well as unmute yourself. Thank you.
Yeah, I can see some people are coming up off of the video now. Have any? Oh, do apologise,
sorry,
Catherine.
no,
go ahead.
Well, I'm about to apologise because I just had to tap out for a few minutes with an urgent matter here. So, Tiffany, when and I might have missed it, so you may have covered this, but the role of the substitute decision maker. So, is that in addition to a role that might be given as a part of medical, like the substitute decision making medical treatment. So it's an additional
Actually,
role.
no, that's a great question, Catherine. So when we actually developed this material, we have a video for family members that is labelled who is a decision maker.
Yes.
The reason I'm using the term substitute decision maker now is purely because it's more understood universally. All states can understand the concept of a substitute decision maker. In the state of Victoria, though, we do use the term medical treatment decision maker. It's the legally established substitute decision maker for us. We do clarify that within the site, but I do find that in some of these conversations, it's easier to say substitute decision maker just because of the previous experience many people have had. Interestingly, the medical treatment decision maker only came about in 2018. So prior to that, it was the power of attorney. And when we were talking to people from the community and even within professional circles, they were still using power of attorney quite regularly. So we very much just use substitute decision maker to try and remove that ambiguity. And within our resource, we even just call it the family decision maker.
Yeah, I think that's helpful because you can see that confusion because the requirements of a substitute decision maker or medical treatment decision maker under that set of legislation is quite limited. It's you make decisions in response, like a decision when a decision is needed, as opposed to being able to sort of go in and make decisions. It's a reactive as opposed to initiating decision making. Yeah. Okay.
It was very much a grey point within this resource too. We found there are a lot of circumstances, it seems, in clinical practice where you may have a decision maker who wouldn't formally be a substitute decision maker, but their family are delegating to them as more a surrogate decision maker. Again, this resource, it's not a directive in itself. It doesn't tell people what to do. It's really talking to anyone in that supportive decision-making capacity, but primarily to ones when you're supporting someone who's lost capacity. If you have to make a decision on their behalf because they can't necessarily share what they would choose for themselves, how would you navigate those decisions?
Sorry, Catherine, I muted you because there was a lot of.
I'm sorry, Rose. Yeah. Sorry, Tiffany. It's probably a longer conversation because at that point, then I would be wondering about the role of guardianship. So if someone's got impaired or decision making and unable to make decisions for themselves, then at what point would you then step into? I don't know. Often a guardian might be required when there is different opinions about what might be the best decision, etc. And there's conflict within a family. But it's it is, but I appreciate what you're saying in terms it's a guide. It's about giving people a guide and a sort of a framework to which to understand. Thank you.
We do encourage to follow the framework in the medical treatment decision-making hierarchy.
That's a great question. Thank you so much, Catherine. Have you all received your books? Have you noticed the books turning up at the facilities?
I'm not in a facility. I'm sort of palliative care, so but I'll look forward to seeing it when Rose will show me one at some point, Rose.
There's one on the bookcase next to you.
Oh, okay.
A whole box of them.
Thank you, Rose. Okay.
And Michelle's popped in a comment saying she hadn't quite noticed the one yet in Beechworth. I absolutely suggest you go and have a chat with the unit manager wherever you're working and see if they received a delivery and where they've popped them. And if you really can't find them, just get in touch with us and we will get you some more. Rose and I do have a few that Tiffany's kindly given to us, which we're really happy to share. And then Tiffany, like she says, she's provided her information. Ah, fabulous. There you go. Catherine has located her book. Great. And Michelle's going to go and have a look later on. That's a great idea. Yeah.
I think it's certainly one of the challenges when we have these sort of resources come into the industry, and that it's very easy for them to sit on a shelf. And so it really does kind of take that initiative of dedicated champions to pick them up and start using them in practice. We have been quite fortunate at Palliative Care Victoria of collaborating with a number of other organisations to help support their use. So the Ambulance Victoria are using them in their paramedic community support roles. We also have discussions going with the PEPPER program, which many of you may be aware of, who are starting to use it as part of their training. One of the benefits of this material is, although it's designed for families, it can be very helpful in residential aged care for junior staff to give them some of the language around decision making and palliative care if they maybe haven't had that much experience having those conversations or palliating a patient at that point in their career.
Hi, can I jump in and ask a question? It's my name's Nikki. I work at a Albury-Wodonga Regional Cancer Centre. And sorry, I was a bit late to the session, got caught on the phone, but I'm just wondering whether, like, we have a lot of older patients that come through our centre, and some of them do end up in residential aged care and may not end up going on active treatment. I'm just wondering whether some of the resources would be helpful to have here to give to family members, because they may not be in aged care settings as yet, but may be well on their way.
No, Nikki, I think you raise a very good point. Part of the discussions we're having internally is how can we share these with some of those subacute spaces, knowing that now people are living a lot longer at home and they're being supported on home care packages much later. You start to get those recurrent hospital admissions where they're bouncing back and forth and really in that holding pattern before residential aged care. So we identify that as a perfect time to start these conversations. And we are certainly happy to talk to the service, provide you some resources and offer your staff any introduction to the resources if they would like. But I think it certainly is transferable.
Oh, that's great. We have education sessions on a Monday, so it'd be great to have you guys come and share, if you'd be willing, to our supportive care team.
Most certainly, just shoot us an email. That'd be wonderful.
Excellent. Thank you.
Tiffany, there's no cross-state complications that you can foresee?
No, in fact, that's an interesting point. Palliative Care Victoria is one state entity of the Federation of Palliative Care Arms, essentially from the Palliative Care Australia network. We are currently partnering with the other state CEO organisations. So Palliative Care South Australia has just come on board as a partner, and Palliative Care Tasmania. Essentially, we're still in very early conversations with those branches, because this resource has been developed talking to the Victorian audience, but obviously relatable to people across the country. There are aspects which they will want to modify for their own legislative needs. So to Catherine's point, the point about medical treatment decision maker is an irrelevant term for New South Wales. So they may have minor things to change in regards to what suits their audience, but is definitely something everyone can understand and take stock from.
And just add, technically, we're a Victorian health service in New South Wales. Don't ask.
Border towns.
Yeah.
Brilliant. Thanks so much, Nicole. Anybody else have any questions for Tiffany? I think it's an amazing resource, and we're going to make this recording available. For those of you that probably already know, Rose and I send out a newsletter once a month to, well, it's mostly aimed at residential aged care facilities. However, we are not gatekeeping if anyone wants to receive those. It's specifically around resources around residential aged care. We'll put this recording in there, which will be a YouTube link. But if anybody does not receive that and either wants to be subscribed to it or wants the YouTube link to share among their staff, send us an email. Obviously, Tiffany's provided her details too, and she's very happy to talk to you if you want her to have a chat with your facility or anybody that you might find useful to chat with Tiffany. In that case, I will stop the recording, and then I'll leave the opportunity for any questions post-recording, and then we'll let Tiffany go. Thank you so much, everybody. Oh, Rose has popped in her email address into the comments for anyone who wants to get in touch with us. All right, I'll just pause this recording.